A patient is suffering from heart failure. Which of the following would be recommended by a nurse as part of the patient's healthcare plan? A. Discouraging a diet of fruit and vegetables. B. Checking for swelling of the lower limbs. C. Encourage the daily intake of fluids. D. Encouraging vigorous exercise. Answer is B. Checking for swelling of the lower limbs. Swelling of the lower limbs, known as edema, is due to a buildup of fluid from an impaired circulatory system and is a common side effect of congestive heart failure. It would not be appropriate to discourage fruits and vegetables, as they are part of a heart-healthy diet and should be encouraged. Patients with heart failure are usually put on a water regimen of around 1 to 2 liters of fluid total per day. This is due to the increased pressure on the heart to process fluids and may cause worsening edema. Patients with heart failure need to be careful with the amount of vigorous exercise activities they undertake. Heart rate should be monitored closely to prevent overexertion. A patient has had diarrhea for the past 72 hours. Which of the symptoms would support a diagnosis of hypovolemia? A. Light-colored urine output. B. Decreased pulse rate. C. Wet mucous membranes. D. Dizzy spells. Answer is D. Dizzy spells. Hypovolemia indicates low fluid volume within the body. Dizziness spells would be one symptom of hypovolemia due to the decreased pressure in the brain. Urine would be dark-colored, not light-colored, as the urine contains more byproducts and the kidneys process less fluid. An increased pulse rate would indicate hypovolemia as the heart works harder to spread the limited amount of fluid volume throughout the body. A patient would have dry mucous membranes as fluid is directed towards more vital body organs. The spouse of a patient in a long-term treatment facility asks a nurse for information about the patient's treatment plan. The nurse should respond as follows. A. Ask the patient for the information. B. I cannot give you information on any patient. C. The doctor will speak to you about the treatment plan. D. Can you give me the patient's social security number? Answer is B. I cannot give you information on any patient. Unless the patient has given consent for information to be given to the spouse, the nurse should respond that no PHI, or protected health information, can be given out. Treatment plan information would be considered PHI under HIPAA. It would not be appropriate to direct the spouse to the patient for the information. The nurse should already be aware of the treatment plan information and can ask permission from the patient to speak to the spouse. It is not appropriate for the nurse to pass the buck to the provider. In this scenario, the nurse should tell the spouse that information cannot be given. Even if the spouse knows the patient's social security number, the patient's PHI is protected under HIPAA. Which of the following infectious control methods should be used when caring for a patient with bacterial pneumonia? A. Wear a mask when taking vital signs. B. Do not allow flowers in the patient's room. C. Require the patient to use disposable eating utensils. D. Do not allow visitors. Answer is A. Wear a mask when taking vital signs. A patient with bacterial pneumonia may spread the disease through droplets from coughing or sneezing. Droplet precautions would be appropriate. A mask is required to prevent inhalation of droplets containing bacteria. Flowers can be allowed to be brought into the patient room as this should not worsen the patient's condition, unless the patient has an allergy. Proper sanitization measures are acceptable when handling utensils used by a patient on droplet precautions. Visitors can be allowed provided a mask is worn within the room of a patient who may be coughing. A patient is brought to the emergency room by her spouse. The patient's injuries are indicative of physical abuse. Which of the following actions should be taken by the nurse? A. Question the couple about how their marriage is going. B. Inform the spouse that the patient's injuries appear to be the result of abuse. C. Inform the patient that she will have to speak to the police. D. With the spouse out of the room, question the patient about the possibility of abuse. Answer is D. With the spouse out of the room, question the patient about the possibility of abuse. Using therapeutic communication, the nurse should question the patient about the possibility of abuse. It is appropriate to talk with the patient when the spouse is out of the room, as the patient may be fearful and not answer questions honestly if the spouse is in the room. It is not appropriate to question the patient when spouse is in the same room. It is not appropriate to approach the spouse with suspicion of abuse, as this could cause further damage to the patient and make it more difficult for the patient to leave the abuser. The patient is not required to speak to the police. It is up to the patient to determine if they want to speak to the police, though the nurse can encourage the patient.